Welcome to Key Biscayne Chamber of Commerce's On Location. Today we're speaking with Dr. Paul Malavenda. He's at 240 Crandon Boulevard, suite number 203. Why don't you join me and let's go see Dr. Malavenda. We are now with Dr. Malavenda in one of the treatment rooms. Dr. Malavenda, tell me a little bit about this room, what you do in here, and tell us a little bit about chiropractic.
I'll start with chiropractic because it's interesting that with chiropractic care, we can help you with back pain, neck pain, low back pain, headaches, and other different kinds of symptoms. And the way that it works is that your brain controls your body, but it has to extend as a cable called the spinal cord, which goes down your back and then extends to the right and to the left like a wire called a nerve. Now, this spine of yours, which is composed of vertebras, can actually move out of place, the thickness of a piece of paper, and put pressure on one of the nerves. And that pressure on the nerve causes the pain. So as chiropractors, we correct that. We use our hands. That's where the term chiropractic comes from. Chiro meaning hands, practic meaning practice with your hands, where we place our hands on your back and we create small movements which will now move the bone and take away the pressure of the nerves because it brings back the flexibility of your spine.
Tell us about some of these tables that you have here. What kind of treatments are done on these tables?
We'll use different tables, especially the one behind me. It's called a decompression table. It's a modern way of doing traction. It's actually interesting because more than 20 years ago, when you had a disc problem, the regular traction that was used was not able to correct problems of the disc like a herniated or a bulging disc. With these tables today, we can actually correct herniated and bulging discs.
Do you remember, I remember this, that when you had a bulging disc or something, you were in the hospital and they'd put you in traction in these big old things that your legs kind of would be pulled or something. Remember that?
Where they would raise a leg and kind of like pull the other leg. It was called like over the bed traction or over the door traction.
So chiropractic has come a long way since those days.
Yes, and it does correct bulging disc and herniated disc. So that's interesting because today we have a very different approach which is totally healthy and we can actually correct your problem.
And let's clear up some of the myths. You know, there's a lot of myths about chiropractic, the practice of it. One of them is that once you start going, you have to keep on going forever.
Well, that's a myth. What happens is when you start going, you come a series of treatments, and then you'll get your problem corrected. Now, chiropractic, in a sense, will help you maintain your health. By that, I mean that if you keep your spine aligned or adjusted, or you keep your back in alignment, okay, you can actually keep the nerves functioning 100%. So if that's the case that you would like to do, you can actually have better health by getting chiropractic care on a very infrequent, like maybe once a month or once every half a year, or just coming in for a checkup.
Just kind of like maintenance, right?
It's a maintenance.
Because another one of the myths that I had read about was that chiropractors break your bones. And they don't really break your bones. That's not what they do, correct?
Well, that's a complete myth. And I guess the best comparison in the industry we can give you is that our malpractice insurance costs a lot less than my automobile insurance.
That definitely speaks for something.
Driver.
That definitely speaks for something then. Then why don't you take us around your office and show us the other places that you have here and maybe talk a little bit more about other things that you offer here.
Sure, we'll do that.
We're in the adjustment room now with Dr. Malavenda. Tell us about what you perform in here.
This is a chiropractic table. It's a table where you can actually lay face down or face up. Most of the times you're laying face down because we're going to be working on your back with our hands, or we're going to use different types of instruments like these. They look very
intimidating.
Intimidating, right. And this is an instrument that allows a vertebra to move.
Oh.
And this is an instrument that allows you to do different types of massage. And this is an ultrasound instrument where you apply some electricity. All these instruments with your hands are designed to create flexibility of the spine, and that way you take the pressure off the nerve, and that way your muscles relax, and you take away the pain that the person might be having, whether it's in the low back, the middle back, or the neck, or headaches.
And one thing I'd like to point out is that even though these may look a little bit intimidating, it's actually, all of this is much safer than injections or much safer than surgery. Correct?
Yeah. Plus, one thing that's true today, once again, with technology advancing, that we can get somebody that's crooked, that's called scoliosis, where somebody is completely like that, and they have an angle in their spine not greater than 34 degrees, and we can actually apply treatment and correct that spine. So that's interesting, because back in our days, you could not do that.
No, there wasn't any
They had
really
to wear
care
those
for it.
harnesses and
That's
walk
right.
around with that.
That's
So
right.
with
Very
the
interesting.
use of these instruments today and what we know about the spine, we're able to do that.
Great. Dr. Malavenda, tell us exactly what happens when you have pain in your back.
Well, these are vertebras, and these are discs. The nerve will come out here, and it's an extension of this cord called the spinal cord. This shows different types of problems. One problem here is a fractured vertebra. Another problem here is a ruptured disc. And another problem is a vertebra that moved out of place, or it's misaligned. So a ruptured disc, you're definitely going to need surgery. But the other problems we can take care of by creating that small amount of pressure and creating movement to have the vertebra move into a normal position where it's aligned with the other vertebrae.
So what is the difference between a bulging disc and this one? Is it,
Well,
they're all the same, or?
I'm going to use an example where, let's say you have a balloon and you fill it up with water. And when you press that balloon will press a little bit out of its position. That's called a bulging disc. If you press it harder, it'll extend more. That's called a herniated disc. If you press it to the point where it'll break, that's called a protruded disc. It broke.
And this is like where
That's
the
a ruptured
pain,
disc.
and that's where that's where the pain's coming from, right there.
Where it touches the
So-
nerve receptors.
And so for something like that, though, would you need surgery, or is there something you could do to alleviate the pain?
Something like this, you're going to need surgery and medication because it's already broken and you have to repair it. But where you have a misalignment and it's putting pressure on the nerve, which is more than 90% of the times the pain that a patient is suffering in the back comes from misalignment, we can correct that.
Okay. Okay, well, we're over here now. We can see we're at the spine. Tell us a little bit about this.
Well, here's where you see the cervical part, the thoracic part, and the lumbar part. Now, this is a spinal cord in yellow, and in white is the disc, and these are the vertebrae. So if you can imagine a vertebra moving out of place, it will put pressure on the nerve, and that nerve in this case goes to the legs and it goes to the part of the foot, but it also goes to organs, which are like the digestive, urinary, and reproductive organs. In the upper part of the neck, it'll go to your shoulder, arm, and hand, but it'll also go to organs like heart, lungs, thyroid,
Really?
and throat. So by having pressure on a nerve that goes, let's say, to your intestinal part, it can actually cause you to have constipation. So when you ask the question, what do we do, is by taking the pressure off the nerve, we now allow the body to work to its 100% normalcy, which could be...
So you're not really just treating the spine for the pain, but you're treating other organs as well.
Correct. We're allowing them to function well.
Sometimes you have your patients go and get blood work done, and a lot of people might wonder why. So tell us about why you would have someone go get blood work done.
Well, today the technology has allowed us to look even deeper into the cause of your symptoms, like you might have a thyroid problem or an adrenal problem. And the reason why we ask for blood work is the same reason that you would like to look at like cholesterol levels. But we're going to look at a problem that's underlying and is still not present with what we call standard blood markers. We're going to call them functional medicine. In other words, there's a new table of values when you go do your blood, and I'm a specialist in that.
Oh, okay. Well, that's wonderful to know. I would have never thought that, you could have seen things through your blood work for the spine and all your other organs. It's very interesting. It is. Dr. Malavenda, thank you very much for being with us today. Could you give us your address one more time, where you're located, and your phone number?
It's at 240 Crandon Boulevard, Suite 203, and the telephone number is 305-443-1103.
Thank you very much for being with us today. This is Maria with the Chamber of Commerce. Good day. Paul.